this is the time we're going to get it done. We're working together. We have some great results. We have tremendous spirit. And I think it's something that's just going to happen very shortly. So thank you all very much. We're going to get to work.
The art of the deal. President Trump sounding optimistic about the health care bill, which passed 2 of 3 committees in the House on Thursday and is heading to a full vote in the chamber by the end of this month. But does it have the votes to pass in its current form? It does not seem to, with some of the strongest opposition coming from inside the Republican caucus. Can the president bring those Republicans on board? Joining me now to talk about this all, our all-star panel, former Republican presidential candidate Rick Santorum from the great Commonwealth of Pennsylvania, Neera Tanden, president and CEO of the Center for American Progress, Republican Congressman Mark Meadows of North Carolina and chairman of the Freedom Caucus, and also with us, Democratic Congressman Luis Gutierrez of Illinois. Thanks, one and all. It's a great panel.
Thank you.
Let me just start with you. You heard Mick Mulvaney, the director of the Office of Management and Budget, talking about how he wants conservatives to help improve the bill. You wouldn't vote for it in its current form right now, though.
We wouldn't, and it's not just the Freedom Caucus, it's more than that, so that we're not even close at this point. But Director Mulvaney is right. I think the Freedom Caucus and a number of conservatives are willing to work with the president. And the encouraging thing for me is the president told me personally, we want to make this better for the American people, and he's willing to negotiate. The art of the deal is not dead. And so I think what we'll see at the end of the day are modifications to the Ryan bill that is out there right now, the GOP bill, that truly transforms it to something that President Trump and the American people can support.
Congressman Gutierrez, are you part of this process at all, or are Democrats just sitting by the sidelines opposing everything?
Very, very different process. When 2009 to 2010, let's remember, hundreds of Republican amendments were adopted in the ACA. There were literally hundreds of hearings between the Senate and the House. I mean, it covered 2009, 2010, so it's a very different process. In this process, what I find is there's a really lack of transparency, and I think it's important. It's almost as if, Jake, they said, we're going to take a businessman's approach. We're going to go to the boardroom, right, in the back, in secret, and now we're going to reveal it to the American people. So what I would just say is, moving forward, I'd like to see a healthcare system in which if you have healthcare, you get to keep it. If you don't have healthcare, there's an opportunity for you to join. And keep your hands off Planned Parenthood. Literally, I think the American public, and those at least live in my district, understand tens of thousands of women in my district and hundreds of thousands, millions of women across this country depend on Planned Parenthood for their healthcare. So let's get transparency. Let's have hearings. Let's have witnesses. What's the rush?
Senator, what do you think about the process so far?
I agree. There hasn't been a whole lot of transparency here. I don't think you can defend it. The reality is there needs to be a little bit more openness here. And so I will agree with you on that. I disagree with you completely. I think it's remarkable. You said if you have your plane, you can keep it. I mean, that's something President Obama pledged and certainly didn't come through. And on the Planned Parenthood, look, Planned Parenthood is a very small percentage of women's health care. There's lots of health care clinics out there that do a much more comprehensive job on treating women, and that's what we should focus our dollars on. The big problem that I see is the Republicans didn't do what you have to do in order to get something done. The House always, when it comes to these things, always puts out the conservative bill. And you know the Senate's going to bring it back. What the House did this time is they started out in the middle. And well, if you're a conservative, you're thinking, this is the best we're going to do. Right. That's why they're not voting for it, because they know when it goes to the Senate, it's going to get worse. The House has to come out and set the poll saying, here's the conservative bill, and work from there. And they didn't do that. That's the problem.
Yeah.
You know, I can't even explain this bill because it doesn't seem too conservative or too liberal to me. It's a upside down bill. It charges people who need the most help the most. They have the biggest increase in premiums. If you make $20,000 a year, you're 50 years old, and you live in a rural community, you have an 8-fold increase in costs. That's why doctors, nurses, the AMA, hospitals are all opposing this bill. You have Club for Growth and the doctors and the AARP all opposing this bill because it's an upside down bill. It makes so little sense for people. It doesn't lower costs. It increases. It makes it more unsustainable, the Medicare trust fund. So it's uniting. It's not liberals versus conservatives on this bill. It's the broad spectrum of Americans opposing this bill, and I think that's why it doesn't make any sense to rush this process through. We took 6 months in the House, 6 months to have hearings in the House. This bill is supposed to be introduced and voted on in 3.5 weeks.
So
1/6 of the economy, 3.5 weeks.
a group backed by House Speaker Paul Ryan, the American Action Network, is out with television ads pressuring members of the Freedom Caucus, your group, to vote with President Trump on health care. Take a listen.
Repeal and replace Obamacare.
Tell Congressman Labrador to vote with President Trump.
Do you think those ads will be effective?
Well, I don't think they'll change any votes, if that's what you mean. I mean, when we really look at it, Nira was talking, and so here we have someone from the left and someone from the right who agree on one thing. We've got to lower health care premiums. If we don't do that, Jake, we have failed. And this current plan doesn't effectively lower health care premiums.
How do you do that? How do you effectively?
Well, I mean, listen, I campaigned on repeal and replacement of Obamacare, and so we would disagree on a whole lot of aspects. But when you force insurance companies to provide a certain type of coverage, and you can't buy a cheaper coverage. Today, you and I cannot buy a catastrophic plan because of what is put out there. And so we've got to make sure that we give the flexibility in terms of the number and types of plans that can be bought to drive it down. And if we don't do that, then we just have Obamacare by another name. The president and I, as we talked about it, he wants to drive those costs down. I'm confident that if we work together, and I've reached out to 5 Democrats. I said, you know, my district's not the same as Luis's or any others. So I said, give me some ideas on what you would like to see. Ultimately, the president is going to be the chief negotiator as well as the commander-in-chief, and I think that we will see a better bill that passes the House and goes to this.
I think, Jake, this is a fundamental difference in how we see public policy. Now we see the role of government. So national defense, that's the government's responsibility. Education, government responsibility. I see in this the richest nation, the nation spends the most money on health care, and I see tens of millions of Americans, citizens of this great nation of ours, without health care, and I say shame on us. Now, I bet at the end of this debate, the members of Congress, after we've decided how we're going to vote, are all going to get government-sponsored health care. They're all going to go back to their government-sponsored health care that we receive as employees of the federal government. Why can't we do for the American people what we do for ourselves?
This is the false narrative that started Obamacare. It's a continuing false narrative. People
What's
aren't
false
getting
about
health care. That's absolutely not true.
Well, they're getting it at the emergency room.
No, well, they're getting it more at the emergency room now. Actually, emergency room visits are up as a result of Obamacare because Medicare expansions has caused more emergency room visits. The bottom line is, before Obamacare, Americans got health care. There's a law in place that everybody got health care. The question is health insurance and what kind of insurance. We went from a system where everyone got health care and the best health care in the world at a reasonable cost to a system now has everybody has insurance, but they're not getting health care. People on Medicaid, because Medicaid is blown up and Medicaid providers have not blown up, they're not getting health care anymore because under Medicaid because they don't have access to providers. This is a false narrative.
Okay.
And you can't accept that narrative as a basis for going forward with this next bill.
We have facts here. 20 million people have received health care because of the
Health
Affordable
insurance.
Health insurance because of the Affordable Care Act. And they are healthier because of the Affordable Care Act. And the reality is that Donald Trump promised voters that they would keep their coverage. And now we have estimates from this plan that he endorsed that 15 million people would lose it. States like North Carolina, the prices go up the second most. Alaska, the most. The reality is here, people relied on him they voted for him, who got the Affordable Care Act, saying they would keep their coverage and it would get better. And the Ryan plan is less coverage at a higher cost, worse all around. And I think that's what's fueling a lot of anxiety amongst Republicans and Democrats.
And when you look at rural America, one of the greatest beneficiaries of Obamacare, here's what you have. What you have is a woman. She's in North Carolina. She was in the New York Times. She pays $260 a month for her health care plan. She gets a $791 subsidy. Well, the Republicans are offering her $2,500 to $4,000 in subsidy. She can't afford health care. Here's what happens. She said, I voted for Trump because I thought he was going to reduce my health care. Now I'm realizing that under this program, I'm going to pay more, if not be completely shut out of the health care
There won't be any insurance policies left in rural America, number one. There's only like a big percentage of counties only have one
we're
plan.
Down to one carrier.
Yeah,
I know,
come on.
and that's because Republicans have undermined the ACA.
Great stuff, and this issue is not going away. We'll have you all back. Thanks, one and all, for being